to use a bougie, and this is actually kind of a last resort because you would really like to see visually that you put the bougie or the trachea tube directly into the trachea. But if you can't see beside the tube and you don't have any way of using an Aintree tube exchange catheter or an ARNT, which will allow you to visualize the placement of the catheter into the trachea, if you have to do this blindly, then what you can do is make sure that the King Airway is centered laterally, because what's going to happen here is the bougie will pass through the ventilation lumen and out the ventilation port towards the airway inlet. However, you don't know if it's lined up or not. So we need to make sure that it's lined up laterally, to make sure it's not taped off to the side, because then obviously it's going to be aimed the wrong direction. Then the next thing to figure out is how is it lined up vertically. And so what we suggest is err the side of pushing it in a little bit further to begin with. Advance gradually, tactily, and if it meets obstruction, gradually retract as you're feeling, and once it goes, feel for the tactile, the tracheal rings, and advance it into position. You can deflate,